Nutritional Infection, chapter 26, page 461. So this is called the vicious cycle of nutritional infection. If you pay attention here, if a person is infected, okay, obviously their health is low, and they will lose their appetite when you are going through an infection. You have fever, you have other symptoms associated with the infection, because of which your appetite is reduced. Okay, so definitely your nutritional intake is reduced, and even if you're taking some nutrition, some food for survival, absorption rate is much more low by your intestine, so malabsorption is there during infection. And increased catabolism. Catabolism means your body knows that there is malabsorption, there is no nutrient intake from the subject, so definitely body goes into a state in which it will try to cut down its own proteins, cut down its own carbohydrates, take out the carbohydrate glucose from the stores, take out the fat from the stores. Okay, that is the situation of catabolism, when the body goes into a state where it tries to use up its nutrient stores uh, in the form of fat stores from your adipose tissue, uh, glucose from your stored in your liver, from your in your muscles. Okay, these things are used up, and even the proteins, even the proteins are used up, muscle proteins. Okay, these are used up for the body functions. That is a state what we call as catabolic state. The body goes into a state of catabolism. Okay, so during infection, your body goes into a state of malnutrition because of all these reasons. Now, during malnutrition, what happens when a body, when you go into a state of malnutrition, your immunity is impaired. Okay, and because of impaired immunity, impaired barrier protection. Barrier protection means for example, saliva is also a form of barrier protection. You go into your respiratory system, you have mucus there. Okay, mucus lining is there around your trachea. That's a barrier protection. Your skin is a barrier protection. Okay, a healthy pH of the skin is a barrier protection. So the conjunctiva, the moistness of your conjunctiva, that is another barrier protection. Okay, so these all barrier protection will get impaired. So you will, because of the malnutrition with infection has induced, this malnutrition can further lower your immunity in such a way that you are at risk of getting more and more infection. Okay, so this is the vicious cycle of infection and malnutrition. One will definitely lead to the other will again aggravate the other. Okay, so this is the nutritional infection vicious cycle. Is it clear to you all, the interrelationship between malnutrition and infection? How infection leads to malnutrition and how malnutrition again leads to infection. Some simple questions will come from here, not much. Coming to immunity, human body has the ability to resist almost all type of organisms or toxins that is supposed to damage your tissues, organs, or health. Okay, so this is what we call as immunity. Okay, so we have this two major forms of immunity in humans. We have these two major forms of immunity. One is your innate immunity, and one is the adaptive immunity. Okay, in innate immunity, these are the immunity cells, or the immunity that you are born with. A newborn is born with. Okay, for example, humoral and cellular immunity. Humoral immunity has cytokines that are supposed to destroy the microorganisms that attack your body. Cellular immunity are your WBCs. Okay, this macrophages, granulocytes, basophils, eosinophils, they all come under the WBC. Okay, so a child is born with that. Innate immunity is something a child is born with. Adaptive immunity is something that the child gets. Okay, either the child grows in an environment where infection is there, the child gets infection, body learns it, body memorizes this infection, and body prepares the antibodies. Okay. For example, once you get chicken pox, okay, once you are afflicted with chicken pox as a child, your body gets the memory of that disease condition. Antibodies are prepared. Second time you will not get chicken pox. Okay. So that is the adaptive humoral immunity. Antibodies are produced. Antibodies are only produced when you have to be infected, or you will have to get vaccinated. Either in these two situations, antibodies will be produced. Okay. Either the person has to get infected by a specific bacteria, virus, or fungi. Only then specific antibodies to fight that specific bacteria, virus, or fungi will be created in your body. That is antibody. Otherwise, you get antibodies through immunization as well. Okay. So that is also acquired. You are getting it from outside. Even if it's an infection or even if it's an immunization, it's adaptive. It is acquired. You are getting from outside. Okay. Cellular immunity, lymphocytes, okay, and immunoglobulins that a child gets from the breast milk. Okay, that is also cellular immunity. It is acquired, that a person gets. It is passed on. Okay. So coming to acquired immunity, coming to the immunity that you are passed on, immunity that develops during your lifetime. You're not born with it. Okay. Nobody is born with acquired immunity. That one gets only after being vaccinated through breast milk. Okay. And either through getting infected at any point of their life. Okay. So active immunity develops in response to an infection or vaccination. Natural or artificial. Natural is antibodies developed in response to infection. When the child is born, the child fell sick because of some infection. Okay. That is the natural form of active immunity. And the child's body registered that infection, registered that information of an infection. Antibodies were made so that in future, the child, whenever gets that infection, easily the body can attack it. Okay. So that is natural active immunity. Artificial immunity are the antibodies that a person or the child develops within their body in response to a vaccination. Okay. For example, BCG vaccination, tuberculosis vaccination at birth when the child is getting. Okay. In that, live attenuated Mycobacterium tuberculosis is present. Okay. So you are giving the child live attenuated bacteria through vaccination. Okay, in vaccination means you are introducing that bacteria into the body, and it is the body's responsibility now to make antibodies. So artificially you are giving an infection so that the body can, in response to that, the body can prepare antibodies. Okay, so that is active immunity. These are the two types of active immunity. Active acquired immunity. Okay, passive immunity, it is passed on to you. From the name itself, it is passed on to you. Develops after you receive antibodies from someone or somewhere else. Natural antibodies, natural passive immunity, it's a natural physiological way, that is breastfeeding. Antibodies received from a mother through breast milk. All the immunoglobulins that is there in the mother's breast milk is a passive immunity. It is passed on to the child from the mother. Artificial passive immunity is the antibodies received from medication. It's not vaccination. Okay. This is, it is not vaccination. Vaccination, you are giving bacteria. You are giving live attenuated virus or bacteria, whatever you're giving into the child. Okay. Or an organism you are introducing into the child or a person in the form of vaccination. But when it comes to giving antibodies, you are giving immunoglobulins. You're giving immunoglobulins injection, direct antibodies you're introducing into the person's body. You're not giving them organism. You're not giving them bacteria or virus or anything like that. You're not giving them an infective agents. You're giving them the agents that can kill the infection. That is antibodies. You're directly giving them antibodies. That's the difference between active artificial immunity and passive artificial immunity. In active artificial immunity, you have to introduce an organism inside the body. In passive artificial immunity, you have to introduce an antibody. Okay, it's an immunoglobulin that you have to introduce inside the body. Okay. For example, when COVID-19 happened, there were two types of prophylaxis that we were sought for. One is the vaccination, in which the live attenuated COVID virus was given. The other form of immunization was people who were cured from COVID-19. Definitely their bodies had the antibodies of COVID-19. Their body prepared the antibodies of COVID-19. So through their blood serum, these antibodies were taken and vaccination was formed to give to other population. Okay, so that was when once a person has recovered from an infection, definitely their body will have the antibodies of that infection. That antibodies are then taken and it is formed into an immunization and it is given to others for their protection. Okay, so this is about acquired immunity. Is it clear to all? The basics of immunity. So nutritionally relevant infections or infestations, which you will come across a lot when these infections which we are going to talk about, they have some or the other relationship with some nutrition, either in form of deficiency, okay, or getting this infection will lead to some deficiency. They came into existence because of a deficiency or it will lead to another deficiency. So these are nutritionally relevant infections and infestation. For bacterial, tuberculosis, whooping cough, infective diarrhea, enteric fever, rheumatoid arthritis, pneumonia, tonsillitis. Okay. TB and whooping cough, you will understand it will lead to catabolism of the body in form of the protein is lost. Protein from the body will be lost. Okay. Even in whooping cough, protein from the body will be lost. Infective diarrhea, water, electrolytes will be lost. Okay. Enteric fever, again, water, electrolyte will be lost because in enteric fever also diarrhea is present. Arthritis, inflammation, antioxidants will be lost. Pneumonia, again, cough will be lost. Tonsillitis, swallowing difficulty. So person will not be eating much. Body will go into a state of catabolism. Even in pneumonia, body will go into a state of catabolism. If it is severe pneumonia, patient may be put in ventilator. So body goes into a state of catabolism. Okay. Viral infections like measles, common cold, influenza, pneumonia can also be viral. Okay. Diarrhea, chicken pox. In all these conditions, the nutrition of the individual is affected. Parasitic infections like malaria, helminths, ascariasis, ankylostomiasis, like tapeworm infection, hookworm infection. Helminths infection means worm infections. Okay, very common in children, not common in at all in adults or senior citizens, but it's very common in children. Worm infections. Okay, so in what happens here is, again, whatever you eat is taken up by the parasite. Okay, it will deprive the host body from nutrition. Okay, that's how parasitic infections are also nutritionally relevant. In malaria, body goes into a stage of catabolism because in malaria, intermittent fever is seen. Okay, fever comes, goes, comes, go. There is a graph in which you will see peak of the fever is seen at night times. Daytime, the fever falls down. Okay, so because of this intermittent fever pattern, the person goes into a stage of catabolism. Okay. And even in hookworm infections and all, not just a nutritional loss, but loss of blood is also seen that could lead to anemia. Ascariasis infection can lead to lack of absorption of nutrients. Viral infections could lead to protein and calorie malnutrition. If it is kids, children who frequently get viral infection one after the other, they are at the risk of developing protein energy malnutrition, either in form of marasmus or kwashiorkor, whatever age group they are. If it's a slightly older child, if the child is about 2 years old or 3 years old, it could be kwashiorkor. If the child is below 1 or 1 year old, it could be marasmus. Now, effect of malnutrition on infection. What happens if a child is already in a stage of malnutrition? Okay, how will infection appear to that particular child? What kind of situation you will be dealing with if the child is already malnourished and the child is at the risk of infection. So, see, severe acute malnutrition, we have specific immunological problems. Okay, humoral immunity. Humoral immunity in the sense your lymphocytes. Okay, your cytokines, not just the lymphocytes, your cytokines, your WBCs. Okay, uh, macrophages, eosinophils, basophils. Okay, they all are sparse. Okay, they are very less already. When the child is suffering from severe acute malnutrition, the humoral immunity, the cell count, immunity cell count is very less. Okay, even the circulating B lymphocytes developed from the bone marrow, they are also they are not unaffected much, but they will be coming down. Immunoglobulins, IgE, IgG, IgM, IgA. These are different types of immunoglobulins that the child must have received from the breast milk. They also reduce over a period of time. Okay, and all these components, when they reduce, the child is at higher risk of getting infection as compared to its peers. Okay, and also the children who had a history of severe acute malnutrition, their thymus gland is supposed to produce T lymphocytes. T stands for thymus glands. Thymus lymphocytes, T lymphocytes is produced by the thymus gland. So at an early age itself, the thymus gland will reduce in size. Atrophy of thymus gland means it will reduce in size. When the thymus gland reduces in its size, lower and lower amount of T lymphocytes will be produced. Okay, thymus glands will naturally atrophy when you grow old. The size of your thymus gland when you were a child and now when you are an adult is completely different. Okay, you have a very small thymus gland right now, which is practically, if you're an adult about 20 years of age, it will not be practically functional. Thymus gland will not be functional. It's only functional during childhood. Okay, it's enlarged and it is functional during childhood because T lymphocytes has to be produced. But when a child has a history of severe acute malnutrition, thymus gland will start to atrophy. Atrophy means decrease in its size at a very early age. So what will it happen? What will happen here? T lymphocytes, circulating T lymphocytes will also already be very low. Okay. So the number and the functions of T lymphocytes are reduced, putting the child at higher risk of getting infections in the future. Okay. Once the T lymphocytes are produced in your body in your childhood, it cannot be reproduced again in the later adulthood. The amount of T lymphocytes that you have in your body, that's it. By when your childhood is over, when the early adolescent period is also over, the amount of T lymphocytes you have in your circulating blood, it will stay the same. It will not increase later in life. Then in case of vitamin A deficiency, both specific protection and non-specific protection of your immunity will be reduced. Specific protection means chicken pox. Okay, chicken pox has a specific protection. The antibodies that your body has developed against chicken pox, that is specific to chicken pox only. It will not go and these antibodies will not go and attack any other infection. It is a specific uh, antibody that has been produced. Non-specific are your phagocytes and or the basophils, okay, and cytokines. These all are non-specific antibodies present in your body, non-specific cellular response present in your body. It will go and attack each and every foreign body that is going to come into your body. Okay, so in vitamin A deficiency, both of this is reduced. Specific and non-specific protective mechanism are impaired. Specifically, the humoral response that your body has towards bacteria, parasite, and viral infection, cell-mediated immunity. Okay, as soon as a virus arrives near the cell or a bacteria arrives near the cell will release certain lysosomes, etc., cytokines to go and tackle it. Okay, these are natural killers, natural killer cell activity, and phagocytosis. Everything will be impaired in case of vitamin A deficiency. And vitamin A deficiency is again a companion of severe acute malnutrition. all the children who have severe acute malnutrition are also deficient in vitamin A. So this just aggravates, being a severely malnourished child, it just aggravates the chances of vitamin A as well to protect the child. Vitamin C deficiency, it will again impair the immunity. Vitamin C is supposed to help your immunity. It has its antioxidant benefits as well. That will also be impaired. Supplementation of vitamin C in healthy people, it has seen that it can increase your neutrophil chemotaxis. Chemotaxis is also a situation in which your body is able to understand a foreign object has entered the body, and through which you where it has to go exactly. Through chemotaxis, your body knows where exactly, your cells know where exactly it has to go to find this foreign invader and attack it. Okay, so this vitamin C, enough amount of vitamin C supplementation, it is directly associated with healthy chemotaxis mechanism. So during vitamin C deficiency, chemotaxis goes down, okay, reducing the immunity. Vitamin D deficiency, children with rickets, I have not mentioned it on the slide. Vitamin D deficiency, children who suffer from rickets because of vitamin D deficiency, there has been an association with immunoglobulin and immunohematopoietic system, in which RBCs will be reduced, okay, impaired neutrophil phagocytosis, anemia, okay, decreased bone marrow cellularity. If the bone marrow cellularity decreases, B lymphocytes will also reduce in its production, okay. So that is how vitamin D deficiency is associated with immunity, lowered immunity. Iron deficiency. In case of iron deficiency, there is an impaired lymphocyte and neutrophil function. Both lymphocytes, T lymphocytes, B lymphocytes, reduce their function. Neutrophil also reduces its function. Neutrophil is a kind of your WBC, white blood cell. Zinc deficiency can cause the atrophy of lymphoid tissue. You have lymphatic system in your body, okay. Lymph nodes are present in your body, under your jaw, under your armpit, inguinal region. There are different regions in which lymph nodes are present. So lymph nodes are the storage area of your lymphocytes, okay. So lymphoid tissue will atrophy, means the lymph nodes become smaller and smaller. If the lymph nodes become smaller and smaller, it will definitely reduce your immunity. Lymphatic system is supposed to protect your body from any foreign invasion as well. Both your cellular and humoral components which come from the lymphoid tissue will be reduced. Now, effect of infection on nutritional status. When a person is infected, what happens to their nutrition? Now, what we have discussed here in the previous slide was, when a person is in a state of malnutrition, how does it increase the chance of infection? Okay, how does malnutrition lead to infection? Here, in the next slide, we're going to discuss, once you are infected. Now, imagine a situation, a person is infected already. What happens to their nutritional status? Okay. So first is the protein catabolism and negative nitrogen balance, which means, as I mentioned, appetite reduces. The person no longer wants to eat much. Okay. Naturally, when you're infected, you have fever. You will not be eating much. You will be resting more. Okay. The basal metabolic rate of your body is also very high when you're infected or when you're suffering from fever. But the body functions has to take place. The body will go and catabolize. Catabolize means break down its own protein, muscle protein, okay, other proteins which are present in your body. It will be broken down. So amino acids can be released, nitrogen can be released, and other systemic function can take place accurately. Okay, so protein catabolism takes place, protein breakdown takes place. Too much of nitrogen is excreted in the urine as well. So that's why a negative nitrogen balance is created. So that to create a positive nitrogen balance, lot of proteins within your body will undergo catabolism, because protein is the only macronutrient which has a nitrogen atom attached to it. Okay. Then depletion of your carbohydrate stores and increasing resting metabolism, energy metabolism, that is the BMR, basal metabolic rate, will increase during fever. And depletion of your carbohydrate stores, you must have seen once you come back after a fever, or once you have recovered from a fever, you will notice weight loss. Okay, this weight loss is because you have lost a lot of glucose from your body, along with glucose, protein, and fat also from the body has been lost. Your metabolic rate was quite high when you were feverish. Okay, increased gluconeogenesis. Glucose which is stored in your in the liver, it is formed into new forms of glucoses so that it can be used up by the cells. So that is gluconeogenesis. New glucose are created from the existing glucose present in your liver. Okay, that is the name of this situation called gluconeogenesis. Peripheral insulin resistance. It can be overcome. Okay, this form of insulin resistance can be overcome, whatever how much ever sweet or carbohydrates you are eating, the blood glucose level is not coming down. Okay, for a time being, your cells are not able to follow the directions of the insulin. That is the peripheral insulin resistance. When you eat something, pancreas will secrete insulin to bring down the blood glucose level. Okay, in case of insulin resistance, pancreas are secreting insulin, but the body cells are not responding to that insulin. Okay, blood glucose levels are not coming down. That is insulin resistance. Your cells are resisting the function of insulin. Okay, altered lipid metabolism. Lipid metabolism is quite high. Trace element like iron, copper, and zinc will be redistributed based on wherever it is required. In the case of infection, copper, zinc, and iron. Copper also has antibacterial abilities. Zinc also has antibacterial abilities. So definitely these trace elements will be redistributed based on where infection is, what infection is. Increased vitamin utilization and excretion. Even if from diet, if the body is able to absorb the vitamin, that amount of absorbed vitamin will be lost through feces or through urine as well. So effect of infection on nutrients. When you are suffering from an infection, what happens to every single one of the nutrients? Okay, protein, there is a decrease of serum albumin in your blood. Okay, too much of protein may be lost through urine as well. Increased excretion of nitrogen that we have seen, there is a negative nitrogen balance. So to create that positive nitrogen balance, the body goes and catabolizes the protein from the body that we have discussed recently. In case of vitamin A, other specific infections they have given: bacterial infection, viral infection, protozoal infection, helminthic infection. These in detail you do not have to study. You just have to know the effect of the infection on nutrients because of negative nitrogen balance. To create a positive nitrogen balance, more and more protein from your body has to undergo catabolism. That's all you have to understand here. Okay. Based on other specific infections, you do not have to study because it becomes more into the medical side. Okay. Vitamin A, again, intestinal absorption of vitamin A is reduced. So vitamin A, there is a risk of the person going into a deficiency of vitamin A, but it does not have, you do not have to worry about it because the liver has a storage of vitamin A up to 6 months. Okay. Liver has a storage of vitamin A up to 6 months. Only if it is a chronic infection, you have to worry about the deficiency. If it is an acute infection, definitely vitamin A will not be absorbed properly from the intestine, but within a week when you are recovering, after that, just focus on the diet, vitamin A will be stabilized, absorption will be stabilized. And also the liver has a storage capacity of vitamin A for the next 6 months. So acute infections should not worry you, but chronic infection like tuberculosis, okay, like such chronic infections should be a cause of worry. HIV, AIDS as well. B vitamins, thiamine metabolism, vitamin B1, thiamine metabolism is affected. There are chances of beriberi because beriberi is is a disease condition because of vitamin B deficiency. Clinical beriberi could be seen in patients who go into a stage of deficiency. And vitamin B deficiency could also lead to anemia if it is untreated, if supplementation is not given. Ascorbic acid, vitamin C. Children who got malaria, a study has shown that the blood concentration levels of vitamin C has decreased in such children who have been contracted with malaria. And once you start giving the vitamin C supplementation, the symptoms will slowly subside. And also, it was seen that when there is any outbreak of any influenza or flu, whenever there is a flu outbreak, it is usually seen that it affects the children who have lower concentration of vitamin C in their blood. Okay, kids who have low concentration of vitamin C in their blood serum are more susceptible to flu-like situation, influenza. Okay. Vitamin D. If a child is suffering from rickets because of vitamin D deficiency, and if the child gets pneumonia in between, okay, even when the rickets is, even the child is still under the vitamin D deficiency and the child got pneumonia, it may aggravate the rickets, okay. Rickets means bow-shaped leg. If you remember the image, rickets means bow-shaped leg, okay. It can aggravate the shape of the legs as well if the child contracts pneumonia while the child is already suffering from rickets. Iron, specifically iron deficiency due to worm infestations like hookworm disease, etc., responsible for iron deficiency anemia. Malaria can also lead to chronic anemia. And chronic infections or regular intermittent infections that the child or children suffer from one after the other in the early ages of their life, that could also put them under the risk of anemia. Other minerals, if the child repeatedly suffers from a lot of diarrheal situation, enteric fever, gastroenteritis, okay, lot of minerals and electrolytes will be lost from the body. So to recuperate that, either the child may have to undergo clinical management to put the child, admit the child and put the child on IV fluids, or put the child on ORS regularly. Treat the underlying cause. What is causing this intermittent infection of diarrhea? Is it some hygiene related issues? Okay, or the child is sensitive to certain food? Okay, that has to be, root cause has to be addressed here. Lipids, that is fats. In infections such as influenza, that is flu, and pneumonia, it can result in increased liver and fecal fat, that is fat globules getting deposited on liver, or too much of fat that the child may be defecating. Increased amount of fat in liver could lead to fatty liver as well, jaundice, or if untreated, it could lead to jaundice as well. Carbohydrates, low levels of blood glucose are seen in any infectious diseases because the body goes into a state of catabolism. Whatever glucose is present in the body, it is taken up by the cells. Infections and enzymes that are secreted in your body decreases. Definitely the intestinal enzyme also decreases. So the digestion, it decreases the digestive capacity of your intestine as well. And if the digestion decreases, the absorption will also be reduced. Growth and development, kids who we have a history of kids who have witnessed regular infection during their early growing years. Their growth and development will be affected as compared to their peers. Some could lead to, some situations could lead to growth retardation as well. Effect of malnutrition on fertility. If severe acute malnutrition is not clinically managed, if severe acute malnutrition like marasmus, kwashiorkor, if they are not clinically managed, it could be fatal. Okay. If you remember the classes, it will be repeated again for new students. If you remember the previous classes, the first 2-3 days of treating severe acute malnutrition, it could be marasmus or kwashiorkor, it is in the ICU, not even in the general ward, it is in the ICU. Okay, life-threatening situation, critical condition has to be elevated. Only then the child can be shifted to general wards and continue the clinical management. Okay. Vicious cycle of nutrition and infection we have discussed in the first slide itself. They have just repeated that in an entire paragraph. You can read it later. Coming to the nutritional problem in HIV patients. In HIV patients, their immunity impairs one after the other. It takes at least 14 years. Okay. In some cases, the incubation period of the HIV virus is around 14 years. Okay. Incubation period means the virus has entered the body, but the first time when the patient starts showing the signs and symptoms, virus enters the body, and the first time the patient starts showing the signs and symptoms, this time gap could be 10 to 14 years. Okay. So within that 10 to 14 years, the immunity decreases one after the other. The body gets weaker and weaker, and the body cannot fight illness, because if you remember the T lymphocytes and the B lymphocytes, okay, the virus, how does the HIV virus act in your body? They get inside your body, they get inside the DNA. It will use the reverse transcriptase enzyme from the nucleus of your from the DNA. It will use this enzyme and it will try to create copies of its own self. Okay. So when the body is supposed to make the copy of its own DNA or its own RNA, it is making the copies of virus now, HIV virus now. Okay. This is how the HIV virus function, like, multiplies in the body. Okay. So once it creates successful copies of itself, it goes and attacks the T lymphocytes. T lymphocytes, as I have mentioned earlier, when it is formed in the childhood, that's it. The number of T lymphocytes which is formed in your childhood, that formed by the thymus gland, that's it. Okay, you will not get more T lymphocytes in your adult life or anything like that. Okay, childhood and adolescence age, how much ever T lymphocytes your thymus gland was able to produce, okay, that's what you should carry on with your entire lifetime. Okay, so this retrovirus, HIV virus, will make its copies and go and attack and destroy the T lymphocytes. Okay, so now definitely the immunity is gone. T lymphocytes cannot be created back inside the body. Okay, immunity is gone. That's how the body cannot fight illnesses. Even if it is a common cold, the body is not able to fight the common cold. Okay, so infectious diseases like diarrhea, TB, malaria, pneumonia, even if the person had taken the BCG vaccine, if you are staying in India, okay, every atmospheric inches of our atmosphere in India has Mycobacterium tuberculosis. Since we are vaccinated since from birth, and we have developed kind of a natural immunity against the Mycobacterium tuberculosis, we do not suffer much from TB cases, even though India is ranking 1 in tuberculosis cases. Okay, but we kind of have an innate immunity against it as well. But in this HIV patients, that innate immunity also goes down. So they are more susceptible to tuberculosis, malaria, pneumonia, such situations. And when the body goes into a stage of any infectious disease, it could be more than this as well. They have just mentioned 4 here. It could be more than this as well. So once the HIV patient has contracted this, there is no going back. It goes into a stage of, they go into a stage of malnutrition, because if we have seen how infection could lead to malnutrition. Appetite goes, body goes into a stage of catabolism. Okay, absorption from the intestines also is reduced. So all these reasons will lead to malnutrition. The body will be swollen, pale skin, eyes, hair, lack of blood. Person is underweight, very thin, extremely thin. Muscle wasting. Muscle wasting is actually protein catabolism. Body is going and taking the protein from the muscles, from its own body parts. So so person goes into a situation of muscle wasting. They get extremely thin. Their entire skeletal structure is visible. The bony prominences of the body is quite visible. Okay, so this is the cycle of HIV. So micronutrient deficiencies, you can give them multivitamins like any multivitamin complex or mix of vitamin A, zinc, iron. Okay, this can be given. And whatever correction you can do to restore the immune function. So though you cannot compensate for T lymphocytes depletion. T lymphocytes once attacked by HIV virus, it is gone. You cannot compensate that. Okay, but the other form of immunity. Okay, T lymphocytes are one form of immunity, but other humoral immunity, cell-mediated immunity, which people have naturally, those can be amped up. Okay, so zinc is a very important micronutrient here to prescribe to HIV patients. Okay, zinc is also present in the activity of various enzymes within the body. So the other biochemical reactions or biochemical strategies of the body can be carried out even though T lymphocytes are absent. Depletion of antioxidant nutrients like vitamin E and C, selenium, that can also be supplemented. So a multivitamin supplement will be very beneficial to HIV patients since their intestine absorption is reduced, their appetite is reduced. Putting them on micronutrient supplement is one of a strategy here. When it comes to macronutrient deficiency, focus more will be on protein here. Okay, because muscle wasting is seen. It is one of the classical sign of HIV in the HIV case. The last phases of the HIV case, it is AIDS. Okay, in AIDS patient, muscle wasting is a classical sign. So if a person is asymptomatic, if a patient is asymptomatic, not showing any other symptoms of HIV, you will see only mild weight loss in them. But if the patient has all the symptoms of HIV, severe weight loss is seen in them. Okay, body cell mass depletion to a measure to a high extent is seen. Fat depletion, not just the protein, but the fat cell depletion is also seen. Okay, total body water will also be lost through diarrhea. So the body mass through water is lost, through fat is lost, and through protein is also lost. Okay. So this weight loss and muscle wasting is mainly because of inadequate intake of food, malabsorption of the intestine, and all the other metabolic irregularities because enzymes are not functioning well. Okay. Other infections are intermittent and attacking the person. Lack of physical activity in final stages of AIDS. So these are the two main areas, two main nutritional strategies through which you can help the HIV patients. It cannot be cured, but to during the palliative care, etc. These are the two main areas where you have to focus. Multivitamins has to be given. So in case of macronutrient deficiency, specific diet which is protein forward has to be made for the patients. Coming to COVID-19, still a lot of researches are going on regarding COVID-19 nutritional status, but so far what we know is zinc supplements and vitamin C supplements have been pushed in the wave front. But apart from that, just zinc supplements and vitamin C supplements is not enough. Okay, a good balanced diet and to be in a during the convalescent period after you had contracted COVID-19. After that, when you are recovering, that convalescent period, the diet in that period is very important because the body has to recuperate. Because certain symptoms of COVID-19 takes months and months to go away. Okay, so your body must have gone through a lot. So muscle wasting, protein wasting, catabolism. Okay, loss of smell and taste could lead to you not eating well. So your body has to recover all those. Okay, so just focusing on zinc tablets and vitamin C supplements is not enough. You have to get back on balanced diet. Even though you have lost the taste or smell, you have to get back on the balanced diet.